Hello and welcome to Cycle of Health. I'm your host, Dr. Rich O'Neill. Tonight's topic, healthy vision. From what to do to protect your sight, to the major causes of vision loss, to what to do if you've lost your vision. In the studio today to help us are Mr. David DeFrancis, Director of Outreach and Education at AURORA of Central New York, Ms. Susan Gray, Blind Services Coordinator at AURORA, who also happens to be blind, and Dr. Justin Dexter, Ophthalmologist at Eye Surgeons of Central New York. Dave, you meet with a lot of people who've lost vision and are blind in your work. What is the most important thing that you want to tell our audience?
Well, May this year is Healthy Vision Month. This was taped in May, but every month should be Healthy Vision Month. And what we find is the most important thing is yearly vision exams.
A yearly vision exam, that's the number one thing.
Yes, absolutely. The earlier that they can find an issue or a disease, the better off the prognosis in the end, and the better off their vision will end up. So the sooner the better.
I see you nodding over there, Doc. Tell us.
Well, it's a great point. I think there's a lot of confusion that surrounds, when do I need an eye exam? A lot of people who see well don't consider themselves to have any problem, so they don't seek care. Good vision, it starts at birth. Young children are usually examined by their pediatrician, but by the age of 3, it's really the best time to bring your child in for an exam with either an optometrist or a pediatric ophthalmologist. And as long as you have healthy eyes, care from then forwards, if you're seeing well, is usually pretty straightforward. Every once in a while exam every few years is a great idea. But when you get to about the age of 50, an annual eye exam is extremely important because most of the diseases that can blind you or cause a permanent disability in your vision, the probability is much, much higher once you reach the age of 50. So our guidelines are for annual exams every year starting at 50.
Yes, and I love you saying that every year. It's really important, too, for people that are blind to continuously get those annual checkups.
Even if you're blind?
Even if you're blind. Because,
well, that's a shocker.
Yeah. Anything,
why is that?
Anything can happen, and I'll hand that back over to Dr. Dexter.
Yeah, there's a lot more that your eye can do to you besides offer vision. There's diseases of the eye. Most importantly, there's types of eye cancer that could be terminal, that can really affect you, and that's things that we can still detect. And there's other diseases, even if you can't see well, like as a cataract develops, it can cause problems for a patient, even cosmetically, where they don't want to appear to have a diseased eye, and things that we can do to keep their eye looking normal, remaining healthy in a way that you won't lose cosmetic appeal or even lose the eye itself because we didn't manage a problem that you potentially have.
Yes, and even for people that are blind, again, having your cataracts out is something that can give you back a little bit more light perception, and that little bit or that little piece of vision that you get back is a huge win for somebody who's mostly in the dark most of the time. And Dr. Dexter did my cataracts for me, and about a week out after the second eye was done, I was able to see headlights coming at me from cars, and it had been 25 years.
25 years, and that came back?
Yes, it came
back.
Wow.
What was that like to...
It was amazing. I think I was driving my husband a little crazy in the car because I would say, "There's another one." It was exciting, know, just to have that little gift of a little piece more of light.
That sounds thrilling and touching at the same time. Yeah. So, Doc, tell us, what are the major causes of vision loss? What are the things that go wrong with people's eyes?
The 3 biggest and most important diseases that I treat as a comprehensive ophthalmologist, the most common one is a cataract. And cataract is something that 100% of people will have at some point in their life. We start seeing the effects of cataract as early as your 40s with the loss of near vision. And then into your 50s and 60s, you start having problems with glare at nighttime, maybe loss more of fine print or your distance vision to some degree. But usually in your mid-60s to early 70s is when it becomes problematic enough that you come to someone like me for surgery, where I'll remove the cataract, give you the ability to have less glasses and see better. And the nice part about that is once it's been removed, it will never recur. Cataracts only have to be removed once, and you see better for the rest of your life, assuming you don't develop a secondary eye disease.
So if it's, so, you know, I'm approaching 25, so,
Just like all the rest of my patients.
so sometime I'm going to get cataract surgery, but is it as easy and fast as everybody tells me?
There's a lot of trepidation around all eye procedures,
Yeah.
whether it's something as simple as a laser that you can't even feel
Yeah.
to something more invasive like cataract surgery. I do enter the eye because I'm removing parts from the inside and placing a new implantable lens back inside. But most patients will tell me the worst part of the whole procedure is when I take the surgical dressing off, which is a sticker stuck over the face. So it's like peeling a Band-Aid off. So if that's the worst part of the procedure, you can tell it's not too
Not bad.
Not
Yeah.
too bad.
And you said you can have less glasses. I'm interested in that because I don't like wearing glasses. I lose them all the time. Tell me about that. What's available?
Absolutely. So most everyone needs some amount of glasses for something by the time they're at cataract age, whether it's just for reading or perhaps bifocals.
Yeah.
We have very complex equipment where we're able to measure the size and shape of your eye. And then we have very advanced technology in the lenses that we place back into your eye. So even basic insurance-covered lenses, for many people, I can correct your vision at distance to the point where you won't need glasses for most tasks. And then we have more technologically advanced options, which can give you vision both for distance and up close in a way that you don't need glasses for most tasks.
Wow, that would be great. So sign me up. I'm heading your way. So tell us about the other two. You said there were 3 major causes of vision loss. What are the other two?
So number 2 is actually the number 1 cause of preventable blindness in our country, and that's glaucoma.
Number 1 cause of preventable blindness.
Absolutely.
So you really want to get this ruled out.
Yeah, it's really important, and that's the second reason an exam at 50 is so important, because glaucoma is silent. There's no signs or symptoms for the patient. They have no idea they have it, and it's slowly progressive, and every bit of vision you lose from glaucoma is permanent. There's no reversing it. There's no bringing it back.
So you really got to catch this right at
Early.
the outset.
Absolutely.
And so keep going.
So when we catch it, we can treat it, and there's a vast number of options for treatment. But with modern technology, the newest and we consider best ways are things with like lasers. We use drops as well. And then at the time of cataract surgery, we now have the ability to do what we call MIGS, or micro-invasive glaucoma surgery, which is a very low-risk type of glaucoma surgery that can offer improvements in pressure, which is the main problem with glaucoma, is too much pressure inside the eye. So I can perform that with just a few extra minutes while I'm doing cataract surgery to improve the outflow of fluid from the eye, to improve the control of glaucoma. So for many patients, I can reduce their need for drops, sometimes even eliminate drops. And although it's not a cure for glaucoma, it makes the disease that much easier to bear with less burden of needing daily drop administration and less worry for the patient. I also have options for implantable devices that elute medicine from inside the eye. And although those don't work permanently, they last for currently 3 years. Some of the newer generation stuff coming will be up to 5. And who knows where the technology will go. But it's something that I offer to pretty much all of my patients because the studies are showing more and more that aggressive treatment with low-risk operations like MIGS offer more longevity and less vision loss over the long term.
Oh, that sounds cool. So, Dave, are you seeing people with glaucoma at Aurora?
Absolutely.
Vision loss?
Yeah, we see folks with all of those eye diseases, including diabetic retinopathy, which is another. And they come in, and we have to teach them and show them how to maximize their residual vision with magnification and other assistive devices so they can do their daily living tasks.
Yeah, so we're going to see some of those
Yes.
later on today. And, you know, I noticed while we're talking about this, I say we're going to see some of those later on. So much of our language is oriented around vision. It's amazing. You're nodding, Susan.
Yes, yes. And that's familiar and comfortable for us, so people that are blind embrace that language. We're never, ever offended by it. Many of us even say, "See you later."
See you later.
Yeah.
Okay. So those are the 2 of the 3, and the last one, Doc, is?
So the last one is age-related macular degeneration. And I feel like that's the one that is surrounded with the most fear. Because as long as it's existed, we've had no real treatment for the dry type of age-related macular degeneration. And
Dry type.
The
There's a
dry
wet
type.
also, I think, yeah.
The secondary type is wet type, and there's been injections for as long as I've been a doctor, which is not that long, thankfully, but at least the last 15 years. And there's a lot of fear associated with that. But I'd like to speak to the dry type because as a comprehensive ophthalmologist, the vast majority of dry type patients would find their way to me, whereas wet type often spend time with a retina specialist. So macular degeneration is a progressive loss of your central vision. It's often determined by some mix of genetics. There are some risk factors, including smoking. Poor general health can certainly contribute, but for the most part, it's genetic and age, which is why we call it age-related. The bright spot on the horizon here is there's a new treatment that I've started offering in my office called Valeda.
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 It's a drug or a...
It is a device that emits red light. So it's a red light therapy that actually can improve the mitochondrial health of the cells that support the retina inside of your eye.
Oh, cool. You just used the word that I can remember. The only word I can remember from grammar school is mitochondria. So mitochondria health, what does that actually mean?
It's the powerhouse of the cell. It's what helps create the energy needed to sustain life in every cell in our entire body. So they've done studies now for years looking at the progression of vision loss in patients with macular degeneration. And patients who received the treatment with the Valeda had less loss over time. And some patients in the studies actually had an improvement in vision.
Wow.
And although it was a modest improvement, it's still a big finding because up till now, we've had really no treatment to slow the progression at all. So to see that not only that we saw success in slowing progression and some improvement, it's a real bright spot for patients who come in who are very worried about losing their central vision. They know what this disease can do, and they feel a little hopeless that there's nothing that they can do or can have done. Now I can offer something.
That's wonderful.
And right now, Medicare is covering it, which is great, that I have something I can get insurance to cover. And the other insurances will carry suit eventually, but it's a slow process with new technology.
So Dave, when people come to you after they're affected by one of these diseases of the eye, what do you do to start with? What kind of assessment do you do? Or
Well, it starts off with the referral from Dr. Dexter, one of the other ophthalmologists, showing me where they're at vision-wise, their acuity.
And is there a range of?
Oh, yeah.
Like, what are the levels?
Well, there's visually impaired. Okay.
What does that mean?
Visually impaired just means anybody that wears glasses is visually impaired.
Okay.
Compared to low vision, which would be vision that can't be corrected with glasses, contacts, surgery, or medicine.
So your vision is really limited then?
Right.
Okay.
Usually between 20/70 and 2200 for an acuity.
Okay.
I would say for visually impaired. And then you have legally blind.
Okay. What is that? Yeah, I've always heard that term. What does that mean?
Well, with the two diseases that we were talking about, with glaucoma, it would be less than a 20-degree peripheral vision.
Peripheral vision. Okay, so you really got very narrow vision.
Normally, we'd have 180, but when you get down to less than 20, they're considered in New York State as legally blind by way of glaucoma.
And you can't drive?
No, there is some limitations, yes.
You can still drive?
Oh, yes. Oh, yes. You have to have at least one eye 20/40 or better for a regular license. But for a restricted license, I believe like 20/70 or better in one eye, at least one eye.
Okay.
And with macular, it's 20.
So I got to be careful out there on the road because there are people out there who can't see to the side. I ride my bike, and so I got to be really cautious. I didn't realize that.
Yeah,
Okay.
yeah. And with macular, it's a little different. Macular, you lose your central vision, as Dr. Dexter was saying. So glaucoma, you're losing your peripheral gradually, and with macular, you're losing your central vision. We introduce these folks to different types of lighted magnifiers that'll enable them to read their mail again without having to rely on someone else.
Let's see. Let's see one.
Sure, absolutely. This is one of the newest things out there, and this is called a Coolertron, which is
Coolertron.
Coolertron.
What a cool name! I like that to start with.
And it's a great little device. Before, as your vision progressed and as you lose your vision, you'd have to go up in magnification, different magnifiers. So there would be a cost involved in that. But with this one, you've got 5 different strengths, and so you just by hitting a button, you can make things larger, smaller, whatever
Oh,
you
wow.
need. It also has a button where you can change the contrast, so you can change the color from white on black to black on white, which some folks see better. And then lastly, it also has a freeze option where if you find a phone number you need and you can walk over to the phone, it'll stay on there until you unfreeze what's on the screen. And these run like $87, but it's just amazing. It's portable. Dark restaurant, you're going to read your own menu.
Oh, wow.
All kinds of different situations that you can use it with. It's affordable and changes lives, keeps
Yeah,
people in their
yeah.
homes.
What's this little,
This little device here,
orange doodad here?
okay, this little device, how do folks who have vision loss who are maybe legally blind or totally blind, how do they know when their coffee cup is full? Well, we all
That's a
know
good question.
they put their finger in it.
Yeah.
That's when they know. Well, this device here can hang on any coffee cup. It can hang on any juice glass or water glass. And when the glass gets full, it vibrates. So they can feel it vibrate and they know the cup is full.
And don't keep pouring.
Right, exactly, so they don't overpour. And the last device that we have is called Script Talk. And Script Talk, which is a device that you could use. And right now, Susan, you want to tell us?
Sure, yeah. So Aurora, along with the National Federation of the Blind, is working to try to change legislation in New York State so that RFID labels are made accessible for people that are blind or have any type of print disability. So what that means, I can't see my prescription vial when I bring it home, and I can't remember what the pharmacist told me or my doctor told me on how to take that
Yeah,
medication.
who listens to doctors? I mean, you go into the office, they talk to you, you never remember a bloody thing
Right.
after you leave, right?
Right, so this little handy device reads the bottom of the RFID label, which has a chip in it, or if you have a smartphone, our smartphones could be equipped to read those labels as well. So we would always have handy, okay, how many doses was I supposed to take today? Who's my doctor? Is this refillable? Are there any, contraindications
And this
to the
little
drug?
thing would tell you
Would
all
tell you
that.
all of that.
So you take your bottle and you hold it up to it, or
You
what do you
scan
do?
it. You scan it. That
You scan
this
it. Oh,
device
it's a
has an
little
eye
scanner.
that scans it, or our phones have readers embedded in them, and we could just scan that label with our
Oh,
phones
wonderful.
as well.
That, and there's some legislation about this?
Yes, yeah, we just pushed it through. It's in committee right now in the Senate and in the Assembly with lots of support, thankfully, for our senators and our Assembly people that are supporting it. And we're just waiting now that the budget is passed to see if they will bring the bill forward out of
And what would the
committee.
bill do if it's passed?
The bill would mandate that pharmacies need to provide this type of accessibility for prescriptions. unless
For
they-
anybody who's qualified as legally blind? I would
Yes,
assume.
or has a print disability. And it's really at a minimal expense too, so we really want to express that these labels are very inexpensive.
Fabulous.
There are folks doing this now, aren't there, Susan? A couple places
Yes.
you can use this?
Walmart, you can do any Walmart, and then Wegmans and DeWitt also provide Script Talk.
Oh, cool. Now, I see the two of you on this end of the set are wearing some special glasses.
Yes.
Doc, tell us about these glasses.
So these are new Meta AI glasses, and they have built-in cameras and then computers and speakers. So it can do a wide variety of things for the sighted. When I'm out with my kids or family, it'll take pictures or videos. But
Or will it show you a video so you don't have to listen to your kid? No,
unfortunately, no, not yet. Maybe coming soon. But for people who have visual disabilities, it has the ability to look at the environment for me and tell me all about it. And I've been talking to patients about it, and I was extremely happy to find that I already have a patient with a pair.
So Susan, tell us about, what do you do with them?
So I fly frequently by myself, and once I'm dumped off at the gate by TSA and I maybe need to use the restroom, I can navigate by hearing to where the restrooms are because the dryers are fairly loud, but I'm not going to know which one to go into. So I would ask my glasses, hey Meta, look and tell me what you see. It would take a picture and it would say, I see a men's room to your left and a women's room to your right.
Wow. A key distinction. We have to
Very
find
key. But it does things like currency identification, color identification.
So you hold up
the item,
Bills.
yep, and whatever, and have
it'll
it take a
tell
picture.
you $5.
Yes.
And what else will it do? Will it read? Will it read papers?
It reads papers, so if I want it to read a letter that I've gotten in the mail, I'll say, hey, Meta, read this document word for word. It will do that. If I have a recipe on a box or on a piece of paper that I'm cooking with, hands-free, I don't have to hold my phone anymore and get it right. I just look down at that paper or box, and it reads me how I need to prepare it.
Wonderful. Dave, last word to you. What other services do you provide to help the blind?
Well, basically, what I want to get across is once you've been diagnosed and you see the doctor, it's a very vulnerable time for many of our seniors.
Yeah, I could imagine. If we have time, we could talk to you a little about that, Susan, but go ahead, Dave.
They don't know who's going to pay their bills. They don't know who's going to, take them to the store. They can't drive anymore.
Yeah.
They have all these worries about ending up in assisted living or nursing home care, and that's when we come into the picture. The doctors will refer to Aurora. We'll make contact with the patient. The patient will either come in or I'll go to the home, and we will bring equipment, show them equipment, have them reading 8-point newspaper-sized print with the proper magnification, and listening. What other problems are
So
you
really, you help people to maintain their independence.
having? Exactly.
And I would imagine, Susan, you're terrified that you're not going to be at what you're going to do.
Yeah, and we have support groups in all 3 counties that we serve, both in person, and then I also do a virtual support group every month where we're there. We've been there. We're at different degrees, all have different eye diseases, and we can support each other through
Well,
it.
how wonderful. Well, listen, thanks for supporting the whole community by coming here today. And before we wrap our show today, it's time for